My name is Miss Alita Galvani and I am the HR manager. I'll be interviewing you under the following topics that includes the technical knowledge and skills and client-centered care.
My name is Dr. Charity Marani and I'll be interviewing you based on your professionalism and ethics.
My name is Ms. Sonja Cha and I'm the Chief Executive Officer of the Med Clinic, and I'll be interviewing you based on your background and experience. Can you please tell us about yourself and what makes you the ideal candidate of this position?
My name is Mkhongelo Sibui. I'm a certified dermatologist and I am ideal for this candidate because I specialize in holistic well-being for clients and experience working with people who experience chronic pain and supporting them to improve their mobility and relieving them from pain discomfort. So, as a dermatologist who focuses on aromatherapy and reflexology, I'm going to help clients regain their mobility and
can you describe your experience as a dermatologist and the specific areas you focus on?
As a dermatologist, I've been working with a physiotherapist for the past 3 years, and I focus mostly on reflexology and body massages as well as aromatherapy. So I help clients to relax their tissues. I work with soft tissues and joints and ligaments.
Thank you.
The question will be based on the technical knowledge and skills. How do you approach treating a client with a bone, skin and musculoskeletal issues, especially when working with a physiotherapist?
As I have the knowledge of anatomy and physiology, I can be able to help clients with muscular problems because I have basic knowledge on muscles and skin, and I can be able to help with muscle tendons, muscle stretch and exercises and
Have you ever worked with a physiotherapist?
yes, I have worked with the physiotherapist for the past 3 years.
Tell us more about working with a physiotherapist.
So, as a dermatologist, I focus more on body wellness and well-being of the body, and I focus more on the emotional well-being. And working with a physiotherapist is
Take your time.
working with a physiotherapist
Can you repeat the question?
My last question for you is based on client-centered care. How do you manage situation where a client progress is lower than expected?
with creating a treatment plan, I can help clients to see their progress and to see how far they are with the treatment. Such as I can also implement treatment. I can also implement massage machines such as Gaitan machines, which is gonna help the clients to muscularity and to improve their physical well-being. Thank you.
Thank you. Based on your professionalism and ethics, how do you ensure patient confidentiality and maintain professional boundaries in your work?
So as a somatologist, I am not allowed to discuss client's personal information with any other people, and I am going to discuss personal information with the client on a private environment. So I must make sure that the client is very comfortable with me, and I am not going to discuss the client's personal life as well as discussing topics that are not professional with the client.
Okay, ma'am. Since we've come to the end of our interview, is there any question that you would like to ask us?
My question is, as an establishment.
Since we came to the end of our interview, do you have any questions for us?
No questions.
Okay, ma'am. You'll hear from us soon. Thank you, ma'am. Good morning. Welcome to the Gateway Medical Clinic. My name is Miss Alita Galvani, and I am the HR manager. I'll be interviewing under the following topic, which is technical knowledge and skills and client-centered care.
My name is Dr. Charity Maharani, and I'll be interviewing you based on your professionalism and ethics.
My name is Ms. Iviwe Sonjacha, and I'm the Chief Executive Officer of the Medical Clinic. I'll be interviewing you based on your background and experience. I was asking, can you please tell us about yourself and tell us why do you think you are the perfect candidate for this position?
Okay, my name is Titandwe Dogo, and I'm a somatologist. I've been working for about 4 years. And why I am an ideal candidate for this job is because with my background as a somatologist, I worked as a massage therapist, facial therapist, and I've had a lot of experience working with various clients. And I think my skills can complement with the physiotherapy services of this clinic.
For you is, can you please describe your experience as a somatologist and the specific areas you focus on in your practice?
Like I said, as a somatologist, I've worked for 4 years. So I have enough experience, and I've worked and I've specialized with massage therapy and facial therapy. So as a somatologist, I've worked for 4 years, and my practices lies on massage, like deep massage, Swedish massage, and I have also worked as a facial therapist, and I expertise in chemical peeling and deep cleansing. So I've worked with skin and muscles. So I think my skills can complement with the same physiotherapy services.
Another question that we have for you, it's based on the technical knowledge and skills. How will you approach treating a client with both skin and musculoskeletal issues, especially when working with a physiotherapist?
With my experience as a somatologist, I've worked with clients with various musculoskeletal and skin health issues. So I would first conduct the consultation with the client, and also with the physiotherapist, we could come up with a treatment plan, because I, the somatologist, I've worked with massages, meaning it involves muscles and skin. So we can combine our experience as a somatologist and a physiotherapist.
Thank you. My question will be based on your professionalism and ethics. How do you ensure patient confidentiality and maintain professional boundaries in your work?
As a somatologist, I take the patient's conceptions and professional boundaries very seriously. So I'll be storing clients' records safely, and I'll be sharing information with the authorized professionals to be handling the client only. I think that is all. Yeah.
Okay, ma'am, we've come to the end of our interview. We'd like to ask if you have any question for us.
Yes, I do have a question.
Okay, what's your question?
Yes, I do have a question. I would like to know if ever you've had a biggest challenge in your profession.
Our biggest challenge at our hospital was during the COVID-19, because we had so many patients and few staff, because some of our staff were infected with the COVID-19, so they had to quarantine. So that was our biggest challenge in 2020.
Any question, ma'am?
No, I don't have any other question.
Okay, ma'am, thank you. You'll hear from us soon. You are requested to leave.
Good morning. Welcome to the Gateway Medical Clinic. My name is Miss Alita Galvani. I am the HR manager, and I will be interviewing on the following topic, which is technical knowledge and skills, and also the client-centered care.
My name is Dr. Charity Marahani, and I'll be interviewing you today based on your professionalism and ethics.
My name is Ms. Ivue Sonjacha, and I'm the Chief Executive Officer of the Medical Clinic. I'll be interviewing you based on your background and experience. The first question we have for you is, can you please tell us about yourself and what makes you the ideal candidate for this position?
My name is Cindy Lefarude. I own an honors degree in somatology. I believe I'm the ideal candidate for this role because of my unique combination of skills and experience. With of experience in somatology as a whole, I possess a deep understanding of key concepts, for example, cultural competency. My most recent role at the company I was working at has provided me with relevant skills that align perfectly with this position. However, what set me apart is my passion for somatology as a whole, and I am excited about the opportunity to contribute my skills I'm excited about the opportunity to contribute my skills with a company that aligns with my values. I'm confident that my skills, experience, and enthusiasm makes me an ideal fit for this role.
My second question for you is, can you describe your experience as a somatologist and the specific areas that you focus on in your practice?
Recently, I have focused on body assessment, where we evaluate the body structure, the function, and the movement patterns. I also have been doing the range of motion assessment, where we evaluate joint mobility and flexibility, and also postural analysis, where we analyze the posture and identify potential issues.
My question for you is based on technical knowledge and skills. How would you approach treating a client with both skin and musculoskeletal issues, especially when working with a physiotherapist?
I believe that open communication and collaboration are essential in such matters. If a physiotherapist disagrees with my treatment concerns, they also need to discuss how we can find a common ground that prioritizes the patient's well-being. I would also be open to modifying my approach based on how my treatment can contribute to the patient's recovery.
My second question for you is based on client-centered care. How do you manage situations where a client progress is lower than expected?
I would adjust the treatment plan. For example, we would modify the treatment approach. We can consider adjusting the treatment approach, such as changing frequency or duration. We could also set new goals and milestones. We could collaborate with the client to establish new achievable goals or milestones. We can also incorporate new techniques or modalities. We can introduce new techniques or modalities such as massage, stretching, or strengthening exercises.
Thank you. Last question is, have you ever worked with a physiotherapist?
In my 4 years of experience, no, I have never worked alongside a physiotherapist, but I believe that I have the skills that will complement being alongside a physiotherapist.
Thank you. Okay, my question for you will be based on your professionalism and ethics. How do you ensure patient confidentiality and maintain professional boundaries in your work?
In terms of ensuring patient confidentiality, I think it is best to obtain informed consent from the client and also limit access to patient information. The company could also develop a confidentiality policy for all the clients that come to this establishment, and also to respect the patient's autonomy.
Okay, ma'am, since we have come to the end of our interview, do you have any questions for us?
Yes, ma'am, I do have questions. My first question is, how do you describe your management style?
I will describe the management style as collaborative, adaptive, and results-driven.
Okay, thank you. And also, can you tell me more about the team that I will be working with in case I get the job?
Yes.
Can you please tell me more about the team that I will be working with in case I get the job?
Okay, in our team, we foster an environment of open communication, mutual respect, and collaboration amongst team members. Is there any other question for us?
No.
Okay, thank you, ma'am. You are requested to leave and you'll be hearing from us soon. Thank you. Wait, guys, have you thought of who's going to be our who's going to be interviewed? I think number one.